So this is a patient conceived with IVF at 20 weeks with low-lying placenta who has come in emergency with bleeding PV. The arrow here is showing the placenta, which is just near the cervix. That is the cervix. This is the cervix, which the arrow is showing here, and that's the bladder anteriorly. So the placenta is in the posterior wall of the uterus, and you can see that there is no collection which appears black in color between the placenta and the uterine wall. There is a small fibroid in the anterior wall, and the fetal heart rate looks normal. As I sweep the probe in the upper segment, you can see that there is no other finding. The liquor looks normal. The placenta has to be seen in the entire to check if there is any collection in between the placenta and the uterine wall. The same patient, when I do a transvaginal scan, here you can see how beautiful the cervix is looking. You can see there is some collection in the cervical canal, which is very minimal if we look at it. This patient, I have put a cervical stitch as a prophylaxis because of a reason that the Hagar's dilator was going in more than 8 during the hysteroscope, and that's the cervical stitch, which is placed quite low down, and this is the cervical canal where there is collection. The collection looks black in color, and that's the internal os. This is the placenta. As you can see here, it is grade 1 placenta. This is the internal os. The placenta is just touching the internal os, and the placenta, you can see that there is no collection at the internal os which can be seen. Also here you have to note that if there is any funneling, which is not seen in this case. The important point is, in case if there is any cervical insufficiency along with the placenta being low lying, then we'll have to deal with the problem differently. So this is the liquor which you can see, and these are the fetal parts which are seen there. So that's the bladder anteriorly. So otherwise there is not much bleeding. It is less than 1 spoon. So I'm just telling her to take prophylaxis of progesterones and bed rest. Thank you.